Howdy folks, welcome to part 2 of chapter 1. So in this video we'll talk about anatomical position. So you should probably stand up and stand this way in anatomical position. So standard anatomical position, you stand upright, your feet you can see here are slightly apart and your palms are facing forward. And so from now till you're done at the end of your career, when you're 70 years old, you will talk in the clinic with reference to anatomical position. So you should dig it. Two major divisions of the body in anatomical position. So from now on, just always think you're in anatomical position. The two major divisions are the axial division. So that includes the head, the neck, and the trunk. So that's all this part here. And then the appendicular division of the body are your limbs. So your arms and your legs. Body planes. So, even in my microbiology 205, I talk about body planes. So a plane, like mathematically, is just a flat surface along which the body or some other structure can cut, so you can study it. And here's the planes, a couple of the planes that we'll talk about in anatomy. So there's this sagittal plane. Well, it says mid-sagittal here, but the sagittal plane will divide the body vertically. So this way is vertically. We'll divide the body vertically into right and left parts. If it's the mid-sagittal plane, that means it cuts the body equally in half. If it's a sagittal plane, it could be not directly on this midline that would cut the body perfectly into two equal parts. So if it was cut like over here, but it's still a vertical cut, that would be a parasagittal plane. So it's not on the midline. The next plane is the frontal plane. So again, the frontal plane, you look at it vertically. So the frontal plane is also called the coronal plane, and it divides the body vertically into anterior and posterior parts. So this is anterior in the front and then posterior in the back. I just circled the head part, but it would be the whole body. So the frontal plane would go through the whole body and separate it into the front and the back, or the anterior and posterior parts. And then the transverse plane, so this is a horizontal plane, and it divides the body horizontally into superior parts and inferior parts. And when you do this, when you make a cut with the transverse plane, you produce something called a cross section. And then an oblique section would be a section or a cut made diagonally. So maybe something that went like this, that would be an oblique section. And this is from a book that they use at Desert Vista campus. I like it because it's like realistic. It's these models, you got to give them their props. They're just standing there naked. And they show you all this surface anatomy, and they're in anatomical positions. So for example, in the upper extremity, and you should know all these, by the way, you should know all these parts of the test, but these are all regions. So for example, this is the acromial region, more commonly known as the shoulder region. Here's the axillary region, it's the armpit. The brachial region, this is the arm. Cubital region is the elbow. The antebrachial region is the forearm. So sometimes people say upper and lower arm, but really it's the arm here, the axillary, the brachial region, and then you have your forearm. And you've probably heard of carpal tunnel syndrome, so the wrist is the carpal region. The palm, that's easy, palmar region. And then, yeah, that's all they do. Do they do any more for the hand? Nope. And then if we continue on this part of the photograph, the lower extremity is the coxal or the hip region, and then the patellar region is the knee region. The head is called the cephalic region, the facial region, that's easy. Cervical region is the neck. The thoracic region includes the sternal region, so that's where you have the sternum, and then the pectoral region where you have pectoralis muscles. Umbilical cord, that's the umbilical region. The abdominal region, there's your abdominals. Inguinal region, that's the groin. The pubic region, the mons pubis, includes the external genitalia. So in this cartoon, it just shows the penis, scrotum, and testes. And then the lower extremity, you can have the femoral region, that's the thigh. The crural region is the leg. The tarsal region is the ankle. The pedal region is the foot. And then this top part of the foot is the dorsum, and then where you stand is the plantar region. And this is the cartoon from your book. It just goes into it's got a little bit different terminology, but you should know all these. So it shows you the anterior and the posterior parts. In anatomical position, you can look at these things called the abdominal pelvic quadrants. So that's 4. These are divisions that usually the medical personnel use. So they've got the upper right quadrant, the right upper quadrant, so RUQ, the left upper quadrant, so LUQ, and then the right lower and the left lower. And you can see that there's different organs in different quadrants. So for example, if a doctor says, oh, they have a pain in their left upper quadrant, that could be the stomach, it could be this transverse colon, it could be part of the liver here. But anyway, so you should, if you're going into the medical profession, you should learn these. And you always determine these quadrants from the person's right, not the viewer's right. So when I'm looking at this is my right. This would be my right, but it's actually the person in the cartoon's left. So you could, and then like I said, you should consider organs in each region. So for example, the appendix, which is right here, is in the right lower quadrant. If you're going to be an anatomist, then you'd want to learn these regions. So for example, well, here's the umbilical region. We already talked about that. And then above the umbilical region, you have the epigastric. Below it, the hypogastric. On the right side, you have the right lumbar region, the right hypochondriac region, and the right iliac region, and the corresponding ones on the left side too. And then within these 1, 2, 3, 4, 5, 6, 7, 8, 9 abdominal pelvic regions, you have different anatomical. So you should know how to play this game. So your nose, so you find your nose, you find your ears. The nose is ventral to the ears. So the nose is forward or in front of the ears. So the your nose is ventral to the ears. And then you can also do the flip. The ears are dorsal to the nose. So the term superior means above or towards the head, and then inferior can also be called caudal or towards the tail if you're going to be a veterinarian. So now let's do this. Your mouth is what to your nose? If you said inferior, you were right. And then that would make your nose superior to your mouth. Next term, medial, is toward your midline. So if you could cut your body in half, right and left sides, you'd have a midline. So if you're talking about a structure that's toward this midline, that's medial. If you're going out towards the side of your body, that's lateral. So you know that your sternum is here, and your shoulder is here. So the sternum then is medial to the shoulder, and the shoulder is lateral to the sternum. Proximal is closest to the midline or attachment. You usually use the term proximal and the corresponding term distal with your appendages, so your arms and your legs. And then distal is farthest from the midline or attachment, so where your arm attaches to your trunk. So if you get an anatomical position, your elbow is, if you're in an anatomical position, your elbow is closest to the midline of your body, so your elbow is proximal to your fingers, and then your fingers would be distal to your elbow. And then superficial just means closer to the surface. Deep is farther from the surface. So your intestines are deep to your skin, and your skin is superficial to your intestines. And then this is a table, if you've got the Maria book, table 1.1, just gives you the term and then the definition and an example. So you can look at that. All right, what about your body cavities? So in this cartoon, this yellow part is your dorsal body cavity. So remember, dorsal is in the back. And then here's your, in kind of this rose color, this is all your ventral body cavities. So in the dorsal cavity, you've got two subdivisions. So your cranial cavity, that's this guy up here, encases your brain, and then your vertebral cavity encases your spinal cord. So in your vertebral cavity is actually formed by your spinal column, which is bone, and then the spinal cord, which is nervous tissue, is inside the spinal column. The ventral cavity then houses your internal organs. Your internal organs are called your viscera. This is really important to remember. Your internal organs are called your viscera. And there's two subdivisions of the ventral body cavity. You have the thoracic cavity, so this part up here, it's got the heart and lungs in it. And then you have the abdominopelvic cavity. So this is actually the abdominal cavity, and here's the pelvic cavity, and a lot of people just put them together and call them the abdominopelvic cavity. And then this cartoon shows you the details, shows you what each cavity and then subcavity, what they contain. So for example, here's an anterior view of the body cavities. Here is collectively, this is the whole area is the ventral body cavity, and then here's the thoracic cavity, and here's the abdominal pelvic cavity. And then it shows within the thoracic cavity you have this superior mediastinum, and then you have a pleural cavity and a pericardial cavity within that mediastinum. And the abdominal cavity contains digestive viscera, and then the pelvic cavity contains your bladder, reproductive organs, and the rectum. So different types of membranes, sort of an overall look at the membranes. Your skin is the acutaneous membrane. Then you have mucous membranes that line all body cavities that are open to the exterior. So think about it, your nasal cavity is open to the exterior, your mouth is open to the exterior. Any body cavity that opens to the exterior, you have a mucous membrane. And that's the same thing for your anal canal, is lined with the mucous membrane. Then the serous membrane lines all body cavities. So we just talked about the body cavities, the thoracic cavity and the abdominal pelvic cavity ventrally, and then the body cavities that enclose your brain and spinal cord. Serous membranes line all body cavities, and they cover all internal body organs. So serous membranes actually cover your heart, your lungs, your intestines, etc. So serous membranes are, they get a little complicated, but serous membranes are named for the specific cavity and the organs with which they are associated. So, for example, in this top cartoon, you have the lungs. So here's the lungs, and here's this is the serous membrane that covers the lungs. And then the serous membrane that covers the lungs, it's a serous membrane, but it covers the lungs, so it has a specific name because it's in the lungs. It's called the pleura, and the visceral pleura actually sits on top of the viscera or the lungs, and then the parietal pleura lines the cavity that the lungs sit in. So, and this gets a little tricky. So the visceral and parietal pleura, if I ask you what type of membrane they are a serous membrane. And then down here, there's another serous membrane in this cartoon in pink. This is the serous membrane that lines your digestive viscera, and they've got a piece of that serous membrane that covers the viscera, so that covers your intestines, for example. That's the visceral peritoneum. And then the serous membrane that lines the cavity that your viscera are in, that serous membrane is called the parietal peritoneum. So see, in the lungs, that serous membrane is a pleura. In the GI tract, that serous membrane is called a peritoneum. And then in the heart, so it's the serous membrane that contains the heart is called the pericardium. And then you have a visceral pericardium and a parietal pericardium. So the type of membrane is a serous membrane. And if you find that serous membrane in the heart, that serous membrane is called a pericardium. And that pericardium has two parts, a visceral part and a parietal part. If you have a serous membrane and you find it lining, or if you find it in the lungs, that serous membrane is called a pleura. And you have a visceral pleura and a parietal pleura. If you are looking at a serous membrane that's in the abdominal pelvic cavity, that serous membrane is called the peritoneum, and it has a visceral and parietal layer. Okay, now we'll look at the scientific process. I like this. If science proves some belief of Buddhism is wrong, then Buddhism will have to change. That's what His Holiness, the 14th Dalai Lama, said. So way to rock on, Dalai Lama. All right, so when you're doing science, the first thing you want to do is make observations. So if you're a scientist, you study the previous data, so whatever you're interested in, cancer, you read all the cancer papers, and then you observe, you can observe cancer outcomes in the clinic, for example, so basically you're observing. You're either observing through reading or you're observing in the clinic. Then after you get all that information, you make a hypothesis. So you take input from various sources, from the clinic or from papers you've read or from the science that's been done, and you formulate a testable statement. So I like to use the if-then motif for my hypothesis. If A, then B, because then you can test it. So hypotheses in an if-then format. And then if it's a testable if-then statement or format, then you can do an experiment and make more observations of your own. So the hypothesis is tested by the experiment. And then you can make, after you test it, you can look at the results, you analyze the results, and then your conclusion is you either accept your hypothesis or you reject your hypothesis. If you reject your hypothesis, you retweak your hypothesis and try again. And that's where this arrow goes. So if you reject your hypothesis, you can make a new hypothesis. If you go through this rigorous procedure and many experiments and observations support the data that you're interested in, say evolution, then you get to be a scientific theory. So a scientific theory is really the thing to be. So for example, the theory of gravity, the theory of evolution, the cell theory is the theory that all things are made of cells. The germ theory is a theory that says germs cause disease. So when people say, oh, it's just a theory, that's absolutely wrong. It's not just a theory. It might be just a hypothesis or just a conjecture, but it's never just a theory. Theory is that's the big dog. If you're a theory, you're kind of important. So, like I said, I like my hypothesis in a logical if A then B statement. So let's do a simple scientific process. Observation. My car won't start. Hypothesis 1. If my car won't start because the battery is dead, then, so if then statement, then when I replace the battery, it will start. That's a great hypothesis. You can test that, no problem. Just put a new battery in. Hypothesis 2. If my car won't start because it's out of gas, then when I put gas in it, it's going to start. Great hypothesis. You can test it. If my car won't start because today is Monday, then when it is Tuesday, the car will start. Okay, that's kind of that's not the best hypothesis, but I mean, it is testable, so it's a hypothesis. It's weak. Testable means that if you do a proper experiment, you can collect evidence to support your hypothesis. And then you just want to analyze the evidence, and you can say your hypothesis is true or false. And then off you go. So start living your life this way. Stop saying it's just a theory. Say, this is my hypothesis. Put it in an if A then B statement, and see if you can test it.